Hello, my name is Reuben Mathew. Currently, I'm a combined medicine and pediatrics intern in New Orleans, and I'm going to be talking about my story and work with the FDA as a Capella Fellow with Doctors for America. As a child of immigrants and growing up in an underserved community in upstate New York, I originally was interested in a career in global health. After some experience, I pivoted from global health to domestic policy work after realizing that policy was so often the common barrier to progress. I found that the voices of industry and industry-sponsored patient groups seem to drown out the voices of doctors advocating for the public good. Inspired by this need for physician advocates and patient care, I pursued medical school and found the FDA task force within Doctors for America. The FDA is the biggest regulatory organization in one of the most powerful countries, offers a powerful platform to work at the root of high prescription drug prices and unsafe interventions that remain available to patients. So why do I care about the FDA? First, it's because patients deserve treatments that are safe, that work, and that they can afford. One of the first lessons we learn in medical school is first do no harm. It's drilled into us that we need to practice evidence-based medicine, and that means selecting the most cost-effective and safe interventions for patients. I want to protect my patients from unnecessary costs and dangerous interventions at the very source. And to do that, we need independent physician voices to be active at the highest regulatory level. And when it comes to the US market, there's no one bigger than the FDA. It's the gold standard for evaluating new therapies that physicians rely on, and we can't afford to let those standards lapse. One of the ways that FDA approval has been changing is with the Accelerated Approval Program, which began in 1992. It's become a way for pharmaceutical companies to cut down on the years of expensive testing needed for traditional approval. And with this accelerated pathway, you can substitute a lower barrier of proof for your approval using a substitute outcome instead of a clinical outcome. For example, if this was a cancer drug, the substitute would be tumor size and the clinical outcome would be the cancer remission. While the two are correlated, they are not necessarily directly related, which can lead to drugs being approved too quickly that don't work as advertised. A report from the Office of Inspector General indicates that about 36% of these accelerated approval drugs have incomplete trials, meaning that right now we have medications being prescribed to patients under the stamp of the FDA without rigorous testing that proves that they do what they're supposed to do. Moreover, these medications have become a cash cow. Pharma has funded more applications towards this pathway, which we can see in the left chart, than in the previous years, and they've also been hiking up the prices of these accelerated drugs more frequently than in drugs in the traditional approval pathway, which is what you see in the right chart. And this has led to more than $18 billion being spent between 2018 and 2021 on these drugs with incomplete confirmatory trials. Money being spent on drugs that we don't know entirely work, and these are being used on patients. So, as part of my project, we wanted to advocate for rigorous and enforceable FDA standards for drugs and devices after market approval, particularly amongst the accelerated approval applicants. And we also wanted to educate clinicians about the FDA and the need for independent physician voices. One big effort towards educating the clinician community was done when I moderated a panel about McKenna, a really good case study on the dangers of accelerated approval. This was a medication that was approved in the accelerated pathway because it claimed to decrease the rate of premature pregnancies. These claims turned out to be unsubstantiated after follow-up clinical trials, and also had some non-insignificant health risks like hemorrhage. Moderating the panel was an amazing opportunity to educate folks on the harms of accelerated approval and how independent physicians need to push to take potentially dangerous medications off the market and stop them from being approved in the first place. One of my biggest contribution and highlight of my experience as a Capella Fellow was doing an FDA public comment regarding tofersen and ALS medication. This medication was a miracle hope for many patients. And as you can imagine, I had a lot of support. But my role as a Capella Fellow, I learned how to draft a statement with my own patient experience and write testimony towards a message, tone, and time limit. It was frankly difficult to sit through the testimony of so many industry and patient group interests, particularly as patient after patient told heartbreaking stories about how this medication was a miracle worker. However, it was vital to present the compassionate counterpoint that patients will always be desperate for the miracle cure, and that it is always our responsibility as providers and the FDA's responsibility that these patients receive the best, most efficacious, and safest therapies that have been studied thoroughly. And as I said in my testimony, I didn't believe that medication represented the best that we've had to offer, and that is often the case with the accelerated approval drugs. So my Capella Fellowship experience has been amazing, and I was able to do things I never thought I'd be able to do, like testify in front of the FDA or moderate a panel with leaders in the field regarding accelerated approval. These experiences have raised my confidence in my own ability to advocate and be a good messenger in front of these issues and in front of these experts. I increased my awareness of how to find opportunities to advocate directly with the FDA, and through the fellowship, identified a network of like minded advocates and resources. The fellowship has really broadened my horizons and given me a lot of training and skills that I can apply myself when I'm moving forward as a growing physician and a growing advocate. So I hope to spread these messages around in my workplace and to engage with future Capella Fellows as well. Thank you.